Who is at risk of severe flu? According to experts, seasonal flu is usually mild in healthy people, causing only a runny nose, cough, fever, and self-healing after 5 to 7 days if they rest, stay warm, eat well, and receive normal treatment. However, in people with underlying diseases such as cardiovascular disease, respiratory disease, diabetes, or the elderly, flu can cause dangerous complications such as pneumonia, myocarditis, respiratory failure, multiple organ failure, and even death. Seasonal flu is caused by influenza A, H1N1, A, H3N2, and influenza B viruses, which are transmitted through the respiratory tract. The CDC said that a Louisiana resident who was previously hospitalized for severe avian influenza A, H5N1, avian influenza H5N1, died earlier this year, along with dozens of others across the country who have been reported to have contracted H5N1 avian influenza. This is the first person in the United States to die from H5 infection. To prevent the disease, the World Health Organization recommends that the elderly, people with underlying diseases, pregnant women, and children under 5 years old should get a flu vaccine every year. Vaccines help reduce the risk of disease and limit severe complications if infected with the virus. Pregnant women in the first 3 months need to pay special attention, because the flu can affect the development of the fetus. Getting a flu vaccine before or during pregnancy is an effective preventive measure. In addition, it is necessary to take preventive measures such as wearing a mask, washing hands regularly, keeping the body warm, eating a nutritious diet, and avoiding crowded places. When there are severe symptoms such as difficulty breathing, cyanosis, drowsiness, hypothermia, you need to be hospitalized immediately for timely treatment. There are many types of vegetables and spices in your kitchen that can support the treatment of flu at home very well. You should know, of course, they cannot replace the medicine prescribed by a doctor. However, you should know and apply them. Number 1 is probably onions. Onions contain malic acid, phytin and allyl sulfite, and essential oils, mainly the antibiotic allicin, which has a very strong antibacterial effect. Onions have a spicy, neutral taste but are not toxic. Used as a medicine to induce sweating, diuretic, antiseptic, decoction to drink to treat fever, malaria, colds, headaches, and facial swelling. When you have a cold, headache, or stuffy nose, you can crush onions, add boiling water to the pot to steam, or add onions to hot porridge to eat and you will recover quickly. Dosage. Each time you can use a dose of 30 to 60 grams in the form of decoction or crushed and squeezed to get the juice to drink. In addition, you should add onions to your daily meals to increase resistance and proactively prevent flu. In addition, if you cook a bowl of porridge or noodles with a large amount of chopped onions and eat it quickly when everything is hot to make your body sweat, it will be very effective in relieving colds. Currently in some Asian countries, people are spreading a tip to plant a few onions in a glass of water and place it in the room. It can help your room avoid the flu virus from entering or surviving. This is just a popular tip that has not been scientifically proven. However, you can try it because it is not very expensive and does not cause any harm.
Thank you for watching the 5 Minutes Plus channel. Please subscribe so you don't miss any new videos that are meaningful to your health.